Daniela, let's bring you in. As I said, you are at the University for Health Sciences, Medical Informatics and Technology in Austria, and you are a research associate in the Department of Public Health, and you've been looking at government crisis management and basically pandemic preparation research, both on individual and crisis management stuff. I'm sure you've got things that Caroline has spoken about that have resonance with you. Do you want to tell us a bit about what you're involved with and what you think may be some of the main themes that we as a global community need to be thinking about?
Thank you, David, for the introduction. Yes, as I said, I'm a research associate at the Department of Public Health at Tirol in Austria. And during the pandemic, I was working as pandemic management. There also my interest was created for research in preparedness and for crisis and pandemics in general. As I saw the challenges not only on the governmental level, but also on the organizational levels in the healthcare system in Austria. Therefore, I'm currently focusing on a research project regarding crisis and pandemic preparedness. It's Erasmus Plus project, Empowerment for Pandemias, which we will hear a bit more further on. Being part of that project has been incredibly interesting, as we have been interviewing in 5 countries all around Europe, healthcare workers on the organizational individual level, which challenges they had and which lessons learned they could provide. It was very, very interesting. Like in Austria, for example, like in most European countries and all over the globe, there was a huge challenge with resources. Supply chain distribution was a big issue, not only on the level of personal protective equipment, but ventilation, research. Also, the workforce itself was very strained due to the lack of PPE. There was not only a physical strain, but also a mental one. The infection risk was much higher, and the workforce was very, very concerned regarding their own health and the health of their loved ones at home. Also, the mental challenge during the work, seeing their patients a lot of high volume of deaths, and was challenging. And the physical and mental support systems in the hospitals were not quite ready and developed for such long crisis as it was during the COVID pandemic. So the workforce burnout became like a critical issue. We have already a workforce lack issue all around Europe, and the COVID pandemic made the whole issue bigger, and it's not getting better at the moment. The lack of resources, as I said, was not only on the medical equipment and the personal and workforce level, but also on the preparedness regarding pandemics and crisis itself. There was not enough training for the healthcare workers to be prepared. Services organized all around Europe. The training in hospitals for pandemics and patients regarding for that are not very implemented. So the pandemic plans on the governmental and on the organizational level, they were ready, but not quite as adaptable and ready for a COVID pandemic. So they were not, the hospitals and the healthcare organizations, as well as the governmental organizations, were not prepared with a plan they could use during the COVID pandemic. And one further big issue was information and communication, as example. It was a huge challenge. New information emerged more or less daily or hourly during the high phases of the COVID pandemic. Information regarding the pandemic, regarding the virus, but especially regarding recommendations and regulations of the healthcare authorities. So these informations had to be filtered, had to be communicated and broken down for the levels. But as there was a lack of technical resources to communicate these informations quickly and to collect data quickly and efficiently, it was a big issue for decision makers to have data accurately and well communicated in the time frame they needed. Also on the organization level, the hospital management, for example, had to find ways and systems to communicate the information for new regulations or regarding the virus to their healthcare workers in a timely manner, but also in a filtered manner. But the technical development was not quite ready yet, which was kind of a positive effect of the COVID-19 pandemic, because the technological development was speed up in a very, very big time manner. So now hospitals in Austria, the big ones, have apps where they can communicate with the healthcare workers, also information from top to bottom and bottom up. So it's gotten more efficient. That's a positive side effect of the COVID pandemic. And technical development also now is supporting harmonization of the data collection systems and facilities between international and national organizations, also on the regional level, which helps hopefully in the future. Austria, for example, now has a digital vaccine database which was planned to be started in a few years, but now it's already started during the COVID pandemic. And well, as I said, it's very important to learn from those experiences, to collect these informations, to make our systems, our hospitals, our healthcare workers more informed and therefore more resilient for future crises. We live in a time where crises, even a pandemic, could happen very regularly, and it's very important to collect these informations and share with each other, to learn from each other on the regional, on the national, but also on an international level. Therefore, I was very happy to be part of the Empowerment for Pandemias project, which focuses on collecting this first-hand experience from healthcare workers, because it's very important to not only strengthen the individual resilience of all healthcare workers, but also the organizations and the structures themselves. And I'm happy to be here to share some information and hear some information from you.
Thank you, Daniela. I think you've described very succinctly the situation as we moved into COVID, which was one of moving absolutely into the unknown. There's two words which we use in crisis management, which we overuse incredibly, which is unprecedented and overwhelming. But COVID was unprecedented and overwhelming. There was no question about it. There was nothing we'd ever seen to prepare for it. Of course, the thing about it is we need to divide two things. COVID itself, as a pandemic, is not a bad pandemic. It's only a very mild pandemic. You look at Ebola, for example, the morbidity rate of Ebola is 50%. The morbidity rate of COVID is about 1%. I mean, something around 1%, just up or minus. So in terms of a pandemic, it's only a mid-level pandemic. What, of course, was unprecedented was the global lockdown. And it seemed that the world was completely unprepared for that. And we spoke of things about agility or about adaptability. And the truth is that the world went into lockdown within about 2 weeks and sort of got on with it. And I'd be interested to hear your thoughts, because from my perspective, I never felt that the government or the world was really getting the hang of it. They were really controlling it.